Welcome to day 21 of our 30-day CPC exam prep series. Today, we're covering the medicine section of the CPT book, CPT codes 90,281 through 99,607. This section includes a wide range of diagnostic, therapeutic, and preventative services essential for the CPC exam. Introduction. The medicine section is one of the most diverse sections in CPT. It includes services from multiple specialties like Immunology, Psychiatry, Ophthalmology, Cardiovascular, Neurology, and Pulmonary Medicine. You'll see questions from this section in almost every CPC exam, so understanding it well is key. Common categories in the medicine section. Let's look at the major code groupings. Immunization codes 90,281 to 90,399. Vaccination administration 90,460 to 90,474. Psychiatric services, dialysis, cardiovascular, pulmonary, allergy testing, and many more, including special services like home visits and remote monitoring. Immunization and administration codes. Immunization codes include vaccines, immunoglobulins, and toxoids. CPT also includes separate administration codes, which depend on factors like whether counseling is provided, the patient's age, route of administration, like IM, oral, or intranasal. For example, 90,460 is used for the first vaccine with counseling, for children 0 to 18 years. 90,471 is used for injections without counseling. Psychiatry services. Psychiatry codes range from 90,785 to 90,899. They include diagnostic interviews, psychotherapy sessions, individual, family, and group. The interactive complexity add-on code 90785. These are time-based, so watch the time units closely. Also remember, modifier 95 is used when delivered via telehealth. Dialysis and ophthalmology. Dialysis services use codes 90,935 to 90,999, covering both hemodialysis and peritoneal dialysis. For example, 90,935 is a single hemodialysis session in an outpatient setting. Ophthalmology codes include 92,002 to 92,014 for eye exams, and 92,015 for refraction. Cardiovascular and pulmonary services. CPT codes 93,000 to 93,799 cover EKGs, Holter monitors, and pacemaker checks. For instance, 93,000 is a 12-lead ECG with interpretation and report. Pulmonary function testing, codes 94,010 to 94,799, include spirometry and oxygen studies. Other medicine services. Here we have allergy testing and immunotherapy, 95,004 to 95,199. Sleep studies and EEGs, 95,800 to 96,020. Physical medicine and rehab, 97,010 to 97,546. And codes 99,000 to 99,607 for special services, like home visits and medication therapy management. Book navigation tips. Use the Medicine section tab in your Captain book. Look for bold category headings to find sections quickly. Highlight add-on codes, which are marked with a plus sign. Watch for modifiers, especially modifier 95 for telehealth and modifier 76 for repeat procedures. CPC exam tips. During the exam, pay attention to age-specific vaccine codes. Match the correct admin code to each vaccine. Psychiatry codes are time-based, don't miss the time units. For EKGs and sleep studies, distinguish between global, technical, and professional components. Welcome back to the CPC Exam 30-Day Series, brought to you by KS Medical Coding Academy. Today is day 22 where we'll explore non-face-to-face and special services, updated for CPT 2025. What are non-face-to-face services? Non-face-to-face services are those performed without a direct, in-person encounter between the provider and the patient. Common examples include telephone evaluations, online digital visits, remote monitoring, and care management services. Telephone evaluation. Codes 99441 to 99443. These codes are used when a physician or qualified healthcare professional provides an E.M. service via telephone. 99441 is for 5 to 10 minutes, 99442 for 11 to 20 minutes, and 99443 for 21 to 30 minutes. Remember, these are not separately billable if the patient was seen recently for the same issue, or if it results in an in-person visit within the next 24 hours or 7 days. Online digital evaluation. Codes 99421 to 99423. These services are patient-initiated and happen through secure patient portals or messaging systems. 99421 is for 5 to 10 minutes, 99422 for 11 to 20 minutes, and 99423 is for 21 or more minutes, cumulative over a 7-day period. As of 2025, documentation must clearly capture the total time and include patient consent. Remote patient monitoring, RPM codes 99453 to 99458. These codes support ongoing monitoring of chronic conditions using digital health technologies. 99453 is for device setup and education, 99454 for device data transmission, 99457 covers the first 20 minutes of provider time, and 99458 adds additional 20-minute increments. RPM must include both data collection and active management by the provider. Care management services. Chronic care management, or CCM, includes 99490 for 20 minutes per month of clinical staff time, and 99491 for 30 minutes by a physician or QHP. Principal Care Management, or PCM, includes codes 99424 to 99427 and is used when managing a single serious condition. Special Services, codes 99000 to 99091. These include a variety of additional services. 99,000 is for specimen handling, 99,050 is used for after-hours care, 99,058 is for emergency add-on services, and 99,091 covers the collection and interpretation of physiologic data like vitals from remote devices. 2025 CPT Update Summary. For 2025, CPT has clarified time tracking for digital E.M., added consent documentation requirements for care management, and updated remote monitoring eligibility criteria. Make sure to review Captain Parenthetical Notes for bundling rules and exclusions. CPC Exam Tips. Here's what to remember for the exam. Know the time brackets tied to each code. Identify whether a code is standalone or add-on. Understand the 7-day rule exclusion logic. And always check category headers in your CPT book for clarification. These services also apply across specialties, including cardiology, psychiatry, and ophthalmology. Thank you for watching. Stay tuned and don't forget to subscribe to KS Medical Coding Academy for more CPC prep content.